Hello, it's Dr. Rhonda Johnson. Today is Tuesday, October 10th, 2023. And today I'm talking about adults 65 and up and increased risk for severe COVID-19 associated outcomes. But first, I want to acknowledge my feelings about talking about COVID-19 outcomes in the midst of the Israeli-Palestinian conflict, the earthquake in Afghanistan, the ongoing war between Russia and Ukraine, and the serious humanitarian crisis in Haiti and the South Sudan. I am very sensitive to the trauma and tragedy that millions are facing in our world today, and it is hard to not talk about it. But today I'm going to talk about a report that was published in the CDC's Morbidity and Mortality Journal on Friday, October 6, 2023. So the CDC looked at data from hospitalizations and deaths between January and August 2023. And what they found that was adults who were 65 years and older accounted for almost 63% of all COVID-19 associated hospitalizations. Now, most of these hospitalizations in adults 65 and up, the patients had multiple underlying conditions, and only 23.5%, one-fourth of them, had received that recommended COVID-19 bivalent vaccine that was, released last fall. So when they drilled down the data, looking at adults 65 and older, the COVID-associated hospitalization rates were highest among those who were 85 years and older, and lowest among those who were between 65 and 74 years of age. Now, as I mentioned, many of these hospitalized adults had underlying health conditions such as diabetes or kidney disorders, coronary artery disease, chronic heart failure, or cardiomyopathy, and obesity. The CDC said during this time period, these adults 65 and up accounted for nearly 90% of in-hospital COVID-19 associated deaths. So here's my key takeaways. Folks who are 65 and older, especially those with any high-risk medical condition, if they get COVID, they should be evaluated for early outpatient treatment with Paxlovid, Molnupiravir, or Remdesivir, one of those three antiviral outpatient treatments, as early as possible. That's what the CDC paper reported. And in addition, prevention strategies, and we all know what those are, and optimizing ventilation and vaccination are important tools in this high-risk group. So folks, if you have family members, friends, loved ones who are 65 and up or who are 85 and up, make sure that you find out from them what they're doing to minimize their risk of COVID infection this fall and winter. That's my message today. As always, be careful and be well.